Let's ask the expert here with JB Robillard from Robillard Hearing Centers. Tell you what, phone calls coming in, so make sure you get your question in. 613-789-6559, extension 2803. Email us, Facebook us. Get in touch with us if you have a question about hearing and hearing loss today. And we do have several questions coming up to answer today. First of all, we want to continue along our theme. Now, a lot of people are going to ask you, they're going to call you and ask you questions like, does hearing loss typically get worse over time? And I would say common sense would dictate that that is yes.
Yeah, it typically does. It depends on the nature of the hearing loss and also on the severity as well. The more severe the hearing loss, the more likely that auditory deprivation can set in, which is what we talked about. Yeah, typically it does get worse over time. Now, if it's middle ear related, for instance, if it's associated with an ear infection, obviously if that ear infection clears up, it's going to get better. But again,
typically, over time, it will get worse. And that's why I wanted to point out earlier that the sooner you go see about these sort of things, the better off you're going to be in the long run. Because in the end, you're monitoring that situation, right?
That's right.
The earlier you get in. Ken is on the telephone, speaking of infections and the like. Good morning, Ken. How are you? Hello, Ken.
Hello, hi, how are you today?
Very good.
Good,
you have a question for us today?
Yes, I do. My son lost like most of his hearing from an infection. And I'm just wondering if there's like it's been years now. But is there a hearing aid out that might be able to enhance that for him, or?
There might be what, I'm sorry?
Is there a hearing aid that might be able to enhance the hearing?
He had a cyst in his ear, is that right?
Yeah.
And then it got infected and so on? Yeah. That's a tough one, eh? Is that a?
It is.
It's an uncommon sort of thing.
It is, yeah. It's depending if the inner ear was affected. So if the cyst strictly damaged the middle ear, the eardrum, for instance, then of course a hearing aid would be applicable. But if the inner ear, if the cochlea was affected, then obviously that's more complicated. And that can affect the comprehension as well. So what can happen is if there's a lot of damage sustained to the inner ear, then it begins to affect word discrimination, comprehension, and then unfortunately that becomes very challenging. So we'd have to really determine, we'd almost have to do an evaluation, or if you have a recent, you mentioned it's been years. So more than likely we need a recent audiogram to give you some direction there. But the best thing to do, Ken, is give us a call and just schedule a hearing evaluation. And then we can give you some direction. You,
I would assume, JB, work in conjunction with doctors in certain cases, depending, and this might be one of those situations, right? More than likely this individual's already seen an ear, nose, and throat doctor. I mean, we do have an ENT that works with us with a weekly clinic. So, and very often when we do have cases where there may be a disorder or there may be something that requires further medical attention, then that's when we would refer to an ear, nose, and throat doctor. Because obviously this young man has lost a lot of his hearing in one ear. That's right. It's preferable that he, I would suggest doing something about it. The earlier the better, certainly. For those who have, experienced some hearing loss, but not certainly to that degree, on your website there's a test that people can actually take, right? That's right. We've got an online hearing test. So here it is here. You test yourself, and it's pretty easy to do? It's very easy to do. It's better if you're using headphones. And now, obviously, it's not as accurate as a clinical test, but it gives us some indication. I wouldn't say that it's reliable, but really, it's out there. We've just promoted it, or we offer it on our website just to create some awareness for hearing loss. And it's not the ultimate test, but it's something that's, again, a starting point. That's right. It gives you an idea. We do have an email question coming in from Gloria right now. Here's Gloria's question. I've noticed a loud, constant ringing in my ears. It's been going on for many months. Is this normal? I'm 60. Is it age? Not necessarily. Yeah, if there's, especially if there's sudden tinnitus, typically tinnitus will again just will emerge gradually. But if it's something that's rather sudden, or if it's asymmetrical, if it's only in one ear, in her case she mentioned that it's bilateral, so it's in both ears. But yeah, the best thing to do is come in, get a hearing evaluation, get it checked out. Really. This is one of the most common things that you guys hear. It's very, very common. Very, very common. Tinnitus or tinnitus or whatever you want to call it is something that
happens to a lot of people and not necessarily age dependent.
That's right. That's right. Yeah, very often it's associated with noise exposure.
Well, that's exactly what we were talking about earlier, too. In this case, Gloria should get in and get a proper test done, talk to one of your audiologists, make sure everything's okay, and then they can work on the problem from there.
That would be the first step.
Yeah.
Absolutely.
Okay, one more segment to go, so one more chance for you to get your questions in for JB Robillard from Robillard Hearing Center, 613-789-6559, extension 2803. You can email, Facebook, or tweet questions. We'll be back with more of Ask the Expert with the Robillard Hearing Center right after this. If you want to know where you can find the Robillard Hearing Centers, there's the information. Check out their website.